chart. In menstruation, there is ovarian cycle and uterine changes. In ovarian cycle, the cycle begins with FSH. Again, important MCQ that the ovarian cycle starts with which hormone? It starts with FSH. FSH secreted by the anterior pituitary goes and acts on the granulosa cells in the ovary. Granulosa cells are those cells inner layer of the follicle, of Graafian follicle. Granulosa cells secrete estrogen and some amount of inhibin B. Estrogen has negative feedback on FSH. Estrogen has action on uterus, that it starts the uterine changes in first follicular phase or proliferative phase, that it goes and acts on the endometrium and cause proliferation, increase mitotic activity here. Inhibin has negative feedback on FSH. So these two having negative feedback on FSH will lead to decreased FSH level. Main action of estrogen is it leads to LH secretion. So now as soon as granulosa cells starts forming estrogen, LH levels have started going up. LH will do three acts. LH will act on the granulosa cells and will lead to progesterone secretion. This progesterone is less in amount, but it starts, the secretion starts. And this progesterone has positive feedback effect on FSH. So because of the presence of FSH, because of presence of progesterone, FSH will rise before ovulation. This increased FSH will lead to, again, it will act on the granulosa cell, will lead to estrogen formation. So there would be sudden increase in estrogen levels before ovulation, pre-ovulatory phase, that will cause thickening and spin barkite in the cervical mucus. LH has other action, that is, it will act on the theca cells, and theca cell will release androstenediones and testosterone, that is androgens, and they will get aromatized to form estrogen. As the LH is increasing in size, gradually there would be surge, which is 32 to 36 hours before ovulation. Then LH will have peak. After LH peak, 10 to 12 hours after, there would be ovulation. That means release of the ova from the ovary, and there would be formation of corpus luteum. This corpus luteum keeps secreting progesterone, estrogen, and now inhibin A. Progesterone will go and act on the uterus. The endometrium, which is estrogen primed, will undergo now secretory changes, and there would be vacuole formation, that is the first sign, and gradually all secretions will accumulate, so secretory phase will continue here. Presence of progesterone and estrogen will cause negative feedback on GnRH as the progesterone goes on increasing. When the peak activity of corpus luteum is on day 22nd, peak level, that will give rise to negative feedback. Negative feedback to hypothalamus will decrease the GnRH secretion, thus decreasing FSH and LH level. Once these gonadotrophs are low, there would be withdrawal of these hormones, that is estrogen and progesterone. And once there is withdrawal of these hormones, that will lead to vasoconstriction. The proliferated endometrium will not be supported by the vessels. There will be vasoconstriction and shedding of these tissue which has grown. Vessels will get released later, relaxed, and that will lead to bleeding. So there would be the blood plus tissue will be it will come out in the form of menstrual blood, and that is called as visible menses. So this is the whole cycle, which is very important to you to understand the defectiveness. I hope this chart will help you to understand everything very clearly. Thank you.